Okay, so dry eyes. Probably one of my most passionate topics I like to discuss with patients because it causes a lot of visual issues and there's a lot of different things you can do to help take care of it and improve vision overall. Dry eye is a multifactorial disease of the ocular surface characterized by a loss of homeostasis of the tear film and accompanied by ocular symptoms, which include tear film instability, hyperosmolarity, ocular surface inflammation, damage, and neurosensory abnormalities that play etiological roles. What does all that mean? This means that whenever your eyes are dry, you can experience a lot of the following symptoms, which include watery eye, dry eye, irritated eye, itchy eye, burning eye, stinging eye. Eyelids feel like that they're stuck or matted together. Your vision changing inconsistently throughout the day. And if you feel like you have to blink a lot to make things clear up, that's you actually refreshing the tear film a lot more in order to get the vision more clear. Because light, as it enters the eyeball, it needs to pass through the tear film, which is the fluid that sits on the front of the eyeball in front of your cornea. It needs to be consistently clear and even in order for light to pass through evenly to reach the back of your eyes. But if there's gaps, holes, patches, irritated sections of the tear film, you're going to notice some visual changes and fluctuations, specifically at nighttime as well too. Let's say if you're driving at night, let's say if you're driving throughout the day, or if you're trying to read something, or if you work on a computer, you're going to notice a lot of these symptoms and issues that come up. And there's a whole bunch of other symptoms that can cause dry eye as well too. But those are just some of the main ones. So those are the symptoms. Now, what are some of the risk factors or causes of dry eye? Imbalance of hormones. This can be sex steroids, androgen deficiencies, etc. Old age really is not a risk factor or a problem of dry eye. We see this in younger patients as well as older patients. So if you're younger or older, you can have dry eye about evenly the same. We see this in 20-year-olds just as bad as we do 80-year-olds sometimes. Autoimmune collagen vascular diseases. This can include conditions like Sjogren's, that's a big one that we see a lot of, lupus, rheumatoid arthritis, scleroderma, temporal arteritis, polymyositis, I can't even say this, poly, polymyositis, and Raynaud's phenomenon. Even using antihistamines, over the counter anti allergy drugs, postmenopausal estrogen treatment, refractive surgery of the cornea like RK, PRK, LASIK, things like that, thyroid disease, hepatitis C, radiation treatment like chemo, for example, hematopoietic stem cell transplantation, vitamin A deficiency, medications that can interfere, such as your antidepressants, diuretics, beta blockers, etc., diabetes, lots of reading, okay, so like crossword, stitching, crochet, puzzle, toy model construction, anything like that where you're not blinking regularly. And probably one of the biggest ones that I hear a lot about is computer work. Many of us work on computers, digital devices, phones, tablets, whatever it may be. And that's one of the biggest issues we see a lot of times with dry eye is that when patients don't blink enough, or when we don't blink enough, or when I don't blink enough when I'm on the computer, that can cause the tear film to evaporate really quickly off the front of your eyes. So when it comes to dry eyes, I've been mentioning something called the tear film. Let's break that down with this little picture y'all are going to see in just a few moments. So when it comes to the tear film, there are primarily three layers we like to analyze whenever it comes to seeing if something is a problem or if it's causing someone to have visual fluctuations or dry eye symptoms. The lipid layer is located on the outermost portion of the tear film, and it stabilizes the entire tear film because it keeps things from evaporating. It's like an oil barrier that's on the outside, basically. The aqueous layer is right underneath that. It's the largest portion of your tear film, and it's responsible for supplying moisture to your eyes in order for them to feel comfortable and for you to be able to see well. And on the backside is the mucus layer. This innermost layer consists of proteins called mucins that coat the eye and allow the aqueous layer to stick to the otherwise water repellent cornea. Because yeah, the cornea is water repellent. So with the tear film in mind, we like to identify and discover and uncover dryness when it bothers patients by two different types of dry eye. We're going to call this aqueous tear deficient and evaporative dry eye. So the first kind, aqueous tear deficient dry eye. What is that? This is what happens whenever the lacrimal glands produce water from the lacrimal glands located right above the eyebrow at a level that is considered too low, making it impossible for the surface of the eye to remain fully and sufficiently hydrated. So this can happen sometimes when there's inflammation, when the nerve endings haven't or not when the nerve endings are not sending a good enough signal to the lacrimal gland, or there's an autoimmune condition at play, things like that. Next, we have evaporative dry eye, which usually happens when the meibomian glands, extremely important oil glands in the eyelids, become inflamed or blocked. These glands are found in the eyelids and are responsible for the production of the oily portion or the lipid part of the tear film we talked about a few moments ago. This oil keeps the tears stable, slowing down evaporation. And did you know that 86% of dry eye patients, this is information that's been uncovered in the past several years, but 86% of dry eye patients have signs of meibomian gland dysfunction, MGD. This means that the oil glands, the meibomian glands located in your eyelids, are not functioning properly, not giving you your full oil layer, and allowing things to evaporate too quickly off the front surface of your eyes, meaning that they're too dry and they can't retain the moisture that's needed to keep your tear film stabilized. But how do we treat dry eyes? That's where we're going with all this. So you got the symptoms, you got the causes. How do we treat it? If there's any inflammation, we like to identify that first. So if there's any inflamed redness, irritation, stuff that's causing some visual fluctuations to where it's eating up and chewing up the tear film and the corneas, we like to treat the inflammation first, whether that's with steroid eye drops, antibiotics, some prescription dry eye drops, like you may have heard of the names of Restasis or Xiidra, Avenova, especially, it's like a spray that you would spray onto the eyelids if there's any inflammation like blepharitis that's kind of dropping down into the eyes. Pure and Clean, it's another type of spray as well too. And if it's evaporative, we like to look at it in a different light, whether it's something in the spectrum of artificial tears, whether it's in a heated eye shield or like heated eye compress, punctal plugs, etc. There's different forms like that, and we're actually going to put a link right below this video here in a few moments that talks about one way that's really effective that we're going to go deeper into in just a few moments, which involves heat thermal pulsation to really open up those meibomian glands. And did you know that there is a nasal spray available to help treat dry eyes? More stuff like that is coming in the near future. But when it comes to treatment, there is a couple of instruments out there, whether it's called LipiFlow, iLux Squared, IPL, things that involve some level of heat and thermal pulsation to really open up the meibomian glands. Because what happens, we're going to show you a picture of this in just a few moments, is whenever the meibomian glands get clogged and blocked and unhealthy, that prevents the oily tear film from sticking around, which means it evaporates too quickly. Your healthy meibomian gland should look like, at least to us as the eye care professionals, that oil is being produced to the consistency of olive oil. It should look like olive oil. But if they get a little bit cloudy and hardened and clogged, it can look like candle wax, and it can even get worse and get significantly clogged to where we call that inspissated meibum. Meibum is the oil inside of your meibomian glands that whenever that gets clogged, it causes so many visual problems. And things that can open up and heat that hardened candle wax oil, it's like watching candle wax melt after a couple of hours. There's different instruments and procedures and technologies that really help melt that meibum to really get it producing on the front surface of your eyes to clear and stabilize that vision a lot more. And it works very effectively. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications to learn more about your eyes. I'm Dr. Bryce Heffington, and we'll see you next time.